I remember working with two children in particular about 10 years ago. They were two sisters. One sister was about 10 years of age and the second sister was about 8 years of age. I went through all of the breathing exercises with the children. I did determine that the children could adequately breathe through the nose. How could I make that decision? Well, I did the nose and blocking exercise, and then I had them do the steps exercise, which helps to open up the nose even more. Then I had them walking with the mouth closed, and I knew that they were walking with the mouth closed because I used a little piece of paper tape across their lips during wakefulness to ensure that they would breathe through their nose. But not only did I have them walk with their mouth closed, they were able to run with their mouth closed. Any child that's able to run with their mouth closed, it's a sure indicator that that nose is able to handle a significant volume of airflow, that that child's nose works adequately at that time. But yet 1 week later, both children come back in. The 8-year-old child had their mouth closed and the 10-year-old child had her mouth open. So I went through all of the exercise again and again. It was established that both children could breathe through the nose, and 1 week later both children come back in again and the 8-year-old comes in with the mouth closed and the 10-year-old with the mouth open. What's going on? I didn't give enough attention to change the behaviour of mouth breathing with the 10-year-old child. So this is when I started introducing mouth taping during the day to help change the behaviour of mouth breathing. Because ultimately we need to associate the brain with breathing in and out through the nose, and if the child is having the mouth open for a period of time, of course they develop a mouth breathing habit. Now, where does MyoTape come in? Well, you can imagine a child when they are distracted, when they are tired, when they're doing their homework, if they're watching TV, if they're on mobile phone or whatever they're doing. If they are distracted, oftentimes you will notice that the mouth is hanging open. This is the time for children to wear a tape that surrounds the mouth, which is elasticated cotton. Now, our own tape is MyoTape, which serves and does just that. It's an elasticated cotton that's worn surrounding the mouth, and here we have a strip. Now, this obviously isn't going to fit on my mouth because it's designed for children, but you can imagine that I'm just gently stretching the tape about 30%. I'm putting it, if it was the child is putting it across their mouth, was surrounding their mouth, and there's a gentle elastic tension as the tape is worn surrounding the mouth to pull the lips together. So if that child then is watching television or doing homework or playing with toys or whatever they are doing, and if the child forgets to breathe through their nose and starts breathing through their mouth, the tape is going to gently pull their lips together to encourage them to nasal breathe. So every time that child wears MyoTape during the day, and ideally they wear it for about 15 to 30 minutes during the day, every day. And in order to change a habit, and mouth breathing habit, it can be quite persistent. In order to change the habit, we have to work on that habit for between 60 to 90 days. It typically takes 2 to 3 months to change a habit. It doesn't take 21 days.